Okay, guys, I believe I should be on Facebook Live right now. So please, guys, if you see me, please let me know. Today's session is a very important session because that's a session that's really every candidate for ADC, they must learn how to do the things on the right way. Because what I have learned based on the past experience from the candidates, I found them they study very hard. And the things which I really appreciated, I really appreciate this. They really put efforts and they study books. But they're missing something very important, and that what I can see from time to time. They normally missing the critical thinking. How to think about the scenario itself, how to choose the right answer, how to say the right answer. And that's actually what we teach you on every Tuesday. Every Tuesday we have a session, we call it as critical thinking. Apply clinical knowledge, clinical experience. Once you learn how to do this, ADC exam for part 1 or part 2 will be easy for you. So guys, before I start, I would love to check on every one of you guys. How are you doing? Guys, what you can see on the screen, please, if possible, just let me know. Okay, that's great then. Thank you very much, guys. Thank you, everyone. Okay, that's great. Okay, guys, if you see the screen right now, so what we do right now is we're going to discuss these cases, and the case today, can you guys guess what is today's topic? By the way, it's the most common topic in ADC exam, either in part 1 or part 2. In part 1, I believe up to 30 to 50% of the questions related to this topic. It's a topic of dentist. Every dentist must know about this topic. And in part 2, not less than 10 cases in communication OSCE for this topic. It's a basic for us. Yes, you're totally right. Very smart. Dental caries. You're totally right. It's dental caries. Very good. Okay, guys, please, guys, your pen and paper. Your pen and paper, guys, and start write down good information for today. Okay. Let me just check this one right now here. Who's guys willing to do this case today? Guys, and start write down good information. By the way, guys, are you aware? This is also for part 2, not only part 1 candidates. Are you aware that tomorrow we will have a mock exam? And the mock exam topics coming from 1, periodontal diseases, 2, the new periodontal classification. 3, prosthodontics, including removal partial denture, designing, clasp selection, measure connectors, indite retention, trauma guidelines, mainly laxative injuries. And by the way, guys, I made a post already about this. You can check on our Facebook group. And ethics, professionalism, and dental caries. I hope, guys, things clear to every one of you. I want you to score the most in this mock because I'm willing right now to use and follow the same strategy and same marking system as ADC exam. So this is going to be a good eye-opener for both of us, for every one of us, you and me, that where about you are standing right now. What is your level? How far you are from ADC? Hi, Dr. Sharma, how are you going? Dr. Ayushi, how are you going? Dr. Natalie, how are you going? Dr. Yamuna, how are you going? Dr. Sayeda, how are you going? Dr. Jasmine, Dr. Banu, Dr. Mariam, Dr. Zohad, Dr. Neshma, Dr. Sama, Dr. Saunders, Dr. Ajith, and Dr. Winnie, and every one of you guys. Look, there are lots of good names. I really want to, Dr. Mustafa, Dr. Jilan. Guys, I want to say hi to everyone. Now, guys, who's going to do the role play? Who's willing to do role play? You need to be in Zoom, and then raise your hand. Let me check this right now. Okay, I will, guys, explain a little bit about our case today and where about the critical thinking part, because every case has its own critical thinking. By the way, guys, I'm very proud with our 10 champions who has passed part 2 yesterday. I see every one of you. Guys can pass the exam. Believe me, I never gave up on anyone. At any time, I never thought this candidate's not good for ADC or this candidate is good for ADC. Every one of you guys can pass the exam. I have seen this. From where did I build up my experience? This experience coming from a candidate or candidates like you. In some moment or some stages throughout my experience with the candidates, let's say in 2013 or 2014, we have candidates and the candidate, they have circumstances away from dentistry. They are mom or dad, and then they forgot about dentistry. And then even they forgot the basic things. This, how to do cavity, how to prepare the tooth, how to read, how to study. And look at them right now. They're very famous dentists in Australia. That's why I never ever gave up on anyone. I always in my mind, remember, one day there was a candidate that start from scratch and you helped her or helped him. And then they now a famous dentist in Australia. Look, there was a candidate couldn't pass part 1 the first attempt. They couldn't pass part 1 in the second attempt. Yes, guys, I'll be honest with you. Couldn't pass part 1 in 3 attempts. But where about they are right now? They didn't give up, and now they are dentists. They are registered. Never gave up on anyone. And they passed part 2 straight away in the first attempt. The only thing is you should know the right way. And the right way, simple way, is not hard, it's not easy. Just write down what I'm saying. That's it. Follow what I'm saying. If you can do this, you'll be perfect, guys. Okay, now, I see, guys, you raise your hand right now. Dr. Amelia, how are you going? Dr. Dara. Let me just get this on my phone first, because I need to hear you from my phone. Otherwise, I may have echo. Okay, this is now my phone. And there's Zoom. Please, guys, everything I'm saying right now, please, guys, write it down. Because believe me, ADC exam now, it's a vast exam, huge exam, big exam. It's not easy. It's not a small one. You must build up your clinical knowledge. My rule right now is to make you to build up your knowledge. And then once you get any question exam, you will be able to apply this knowledge and then pass the exam. Okay, Dr. Dara, can you hear me? Doctor, can you hear me? Okay, Dr. Amna, can you hear me?
Yeah. Hello.
Yes, Dr. Amna, can you hear me, right?
Yes.
Okay, that's good. And Dr. Sama also. Dr. Sama. Dr. Sama, can you hear me? Only Dr. Amna can talk to me. I cannot hear Dr. Sama. If you talk, unmute again and make your even co-host so you will not miss.
Hi, Dr. Vidra. Sorry, I wasn't able to unmute me.
That's okay. Now it's all good then. It's all good. Guys, how are you doing, guys?
Good.
How we feel,
Good,
guys,
doctor.
about this champions, guys? Guys, doctor, I think, like, the dentist they passed it yesterday, including, for example, Dr. Parsia, for example, and Dr. Ash. I don't know if you have met Dr. Ash in Academy or not, Dr. Amna, and everyone. How we feel, guys, when the people pass?
I don't know her real name is Ashish, or does she have another name?
Ashwarya, I think Dr. Ashwarya. Dr. Ash, Dr. Ashwarya.
Not
She is,
sure, maybe.
she is very, yes, she used, have you seen Dr. Parsia, or maybe in the role play? Because he used to do role play like
Yes,
you.
I know Dr. Parsia, and he was great.
Yes.
Yeah,
You
I
see,
remember Ash as well, Dr. Vidra. She used to participate a lot in the role plays and also in the Telegram group. And I remember her role plays as well.
yes. You see, that's what I'm telling you guys. These champions, they used why they passed. For me, when they passed, or before they passed, I knew they're gonna pass. From where their participation, their role plays, they do the right things. They take the notes nicely. And then they apply what we discussed. They never get confused, right? And that's why these people really can pass because the ADC exam is easy like this. Just to follow in the right way, you'll be perfect. That's it. Okay? And don't doubt yourself and practice on the right way. Not just only practicing the way you want it or the way you confuse yourself, but practice on the right way. Okay? For example, when I discussed with uh, Dr. Parthia, and by the way, guys, for part one candidates, I will be posting Dr. Parthia's 15 points of success. He made it after he passed part one. And he shared it with the candidates. I'm not quite sure it exists in my group, not yet, but I would repost it again, guys, so everyone can look at it from Dr. Parthia. Now, Dr. and Dr. Sama.
Yep.
Both of
Yes,
you
doc.
guys, you attend my sessions, right?
Yeah.
And yesterday, Dr. Amna made very, very nice role play. It was yesterday or the day before, in
Sunday.
our session on Sunday, day before, right? Because
Mhm.
yesterday was part one.
Yeah.
So I was very proud of you. You did really very good the last role play, and I'm telling you from now, if you keep the same level, you will definitely pass OSCE easily.
Thank you,
Dr.
doctor.
Sama, I believe your last role play was about months, right?
Yes, doctor. I think I did last year. Then I didn't do
You see,
any.
month is right, like maybe at least 3, 4 months is right.
Yes,
Please, Dr.
yes.
Sama, please, please. I want you to do more role plays because the more you practice, the more you'll be perfect. Okay?
Yes, doctor. That's what I'm trying to do
Yes,
from
and I
now
will
on.
be next to you. I will be helping you all the time. Just started, and I will be supporting you all the time. I will be next to you. Right, Dr. Amna?
Yes, Dr. Biro, you're very supportive.
Okay, guys, no
You
problem.
will give me a role play every Sunday. I'm
Okay,
kidding.
that's fine then. I'm happy to do this as long as we can do it. I'm very happy. Okay?
If there's time.
Yes.
Yeah.
Okay, guys. So what we can do right now is you don't know what's the case about. Do you know what's the case about? I always surprise you, right?
Caries, no?
You don't Keras. I said Keras, right?
Yes.
But what exactly about Keras?
Like
The risk
cases in
assessment.
children, like 8-year-old child.
How do you know it's just eight? You got the right one. 8-year-old child. Old girl, not a child. Sophia.
Yeah.
Okay. Now, guys, let's discuss these cases together. We have not less than 200 dentists right now with us. Okay.
Mm-hmm.
Let's go through this case and discuss whatever is critical thinking point, the point that you believe you may do mistakes in it. And it does really need you to think deeply to understand what is the right concept here or what is the right approach. Because, for example, for part one exam, the question will be MCQs. For example, they may choose a tooth like this, and then they ask you a question. What sort of pain do you think the patient is having this tooth? Which one of these? Look at this. Is it sensitivity? Look at the. I will tell you guys because the critical thinking it's the same things in part one or part two. The difference is in part one will be format in the MCQs format, and part two will be a patient question. Now, part one exam, they may give you an X-ray like this, and then they ask you a question on this tooth number, guys. Can you please, guys, everyone tell me what's the tooth number here? Everyone, please, guys, write down. Test yourself, please, guys. Don't say, please, Dr. Amna and Dr. Sama, please don't say, okay?
Okay.
Okay.
Okay. So now they say the tooth number, even they may ask a question, what is tooth number? That can be easily EDC exam. And then you need to decide, you need to be able to tell which tooth number it is. Now, the tooth number is this. They say, what sort of pain in this tooth? And then you keep thinking, is it sensitivity? Is it really the pain that when the food was trapped or during biting and then get it better after brushing? Or is it severe type of pain? Options can be this. Sensitivity, no pain, pain get better after the tooth brushing or the food particles is removed from the tooth. Or is the pain which has been worsened and severe pain? This is part one question. Part two, examiner, actually patient will tell you, ask you this way. Okay, do you know, doctor, Sophia couldn't sleep last night.
Mm.
Which tooth do you think that is causing this pain? Or Sophia has a tooth that every time she bites, she feels pain. But once she brushes the tooth and remove the food particles from the tooth, the tooth get better. Which tooth out of this, doctor? What's the treatment, doctor? Then what's the next step? What do we need to do? So this exactly, guys, what we call the critical thinking. Now, some candidates they may telling me, this tooth will have severe pain. No, just sensitivity. No, that's a tooth that has pain with whatever. If I ask both of you right now, guys, I believe you may give me same answer or different answer. So now, if I ask you this tooth, which one of these? Sensitivity or pain of biting plus once you remove the food particles from inside will feel better, or this is a tooth that it worsened by time and made her sleep disturbance. Which one? Guys, please, guys, every one of you answer on the Facebook, just to know, guys, your answer. And please, Dr. Sama and Dr. Amna, both of you, tell me what do you think.
Okay.
So
Should I make it a little bit bigger? Oh, that's I think it's enough.
Yeah.
Which tooth this? Which pain out of the three?
So I can go first.
Yes, please, sir.
Yeah. So this is sorry, can you zoom out a bit, Dr.
I
Bido?
will. I will.
Sorry.
Let me just only remove all this stuff first.
Yeah.
Actually, that's fine. I can zoom now.
Okay. So this seems to be the left side,
Left side, okay.
and this seems to be the baby tooth, the E.
Okay, E, very good.
Yes,
And
but
what
it
sort of pain?
hasn't. Sorry.
Yeah, what sort of pain?
So this hasn't quite reached the pulp horn, so I don't think that it is causing her to be up at night.
Perfect. I love this one.
But
Actually,
Yeah,
I shouldn't answer because Dr. Sama is there. Oh.
yeah.
But anyway,
I believe that
that
it
was a
will
good help,
be
Dr. Sama. Yes,
it
please
will
tell
be
me.
sensitivity.
Just sensitivity?
Yes.
Okay. Which tooth number is Dr. Sama?
So this is the I think this is right side,
Very good.
and it's E,
Very good.
and I believe it will be sensitivity. Like if I see the left side, I can see a tooth where the decay is quite reached to the pulp, where we can suspect the food trapment and the signs of reversible pulpitis. That is food trapped, and then it get worsen the pain.
Good. So, yeah, okay. So now we have three options for you to choose from. Four options. No pain, no sensitivity. The second one, sensitivity was cold and was cold. Third one, food is stuck, and then pain, and then the pain getting better once you remove the food from the hole from the cavity, or the tooth that's result in severe pain and worsen that disturb her sleep. Which one of these four options?
And especially when food was trapped during biting. I believe it's the sensitivity and pain when food was trapped during biting.
Very good. Very good. We both guys agree on this one, which I totally agree on this one too. Okay? So now the only difference right now is the tooth number. One of you saying is right hand side, and the other one says the left hand side. So, guys, what do you think? Everyone here, is it right or left hand side? Let me check the champions' answers. Our champions. Okay. Let me check this. Okay. They say left or right. Oh wow, it's very confusing now. Right, right, left, 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 right, right, left, left, left. Okay, guys, it is actually right, no left. How do we know it? Curve of speed. Look at the curve speed.
Yeah.
I reversed the X-rays. I reversed it intentionally. Did you get it? So this is the right, and this is the left. 1 second, please. I need to be let's remove this first. Remove, delete. Put this one again. Get back into the slide. Yes. Okay, guys. This is the curve speed, and this is the curve speed. I reversed it. So this is the right side, and there's the left hand side. So there's a tooth number. This is upper, definitely, and this lower. Again, be careful about this in exam, either in part one, especially in part two. If they ask you what is tooth number and you're not doing it right, this is really going to be high risk in exam, very high risk, especially part two. Part one will be lose a mark, but part two, you may lose the whole case only because you're not able to do the right, you're not able to name the right. So this is the left hand side, that's right. Definitely, this is deciduous. Baby, 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 baby tooth. All this. And there's baby, baby, baby. Only this is permanent, this permanent, this permanent, this permanent. See now, guys? Now, if I ask a question right now, from here, this tooth or this one, can you tell me which type of pain can result in because of this tooth? This one here? Please,
Like
guys,
she can.
everyone answer as well. Dr. Summer, you can start right now. What sort of pain? Whatever, guys, available, you can start.
Um, can I go? Okay.
Yes, please, because maybe Dr. Sama is.
Yeah, so I believe that it's extreme pain, the one that keeps you up at night because the
Very good.
decay has reached the pulp horn. And also, if we can get a periapical of this tooth, there might be an infection as well.
Very good. I agree in this one. What about the adjacent tooth?
Oh, this one's gone. Like there is extensive decay, and also there is radiolucency in the furcation area.
Do you think this tooth can make the patient be awake as well, or this one more? Which one? This or this?
I think
Either, okay, number, okay, is it A or B? Which tooth?
I
It
think
may make the patient, yes, the child awake.
I think A, because B might have
Very good.
become
I got it.
asymptomatic by now. The nerve is
Yeah,
probably
now
dead.
it already might be dead. Yeah.
Yeah.
Yeah, the nerve is necrotic, right?
Yes.
Yes, and may result in a bit of infection in furcation area. So, what is the treatment for A tooth, and what's the treatment for B tooth, guys?
So,
For
yeah.
yeah, for A, it would be pulpectomy. Definitely
Very
up
good.
in
What
the
are you
end.
going to use for pulpectomy?
So it will be zinc oxyugenol as a dress. Initially, it will be like any leather mixer to relieve the pain, but the definite root canal will be zinc oxyugenol.
Dr. Amna, do you agree on this?
So A, yes, the ridge is involved, so we have to do a pulpectomy.
Very good.
So yeah, I would, yeah, leather mix should be fine.
Yeah, but we need, yes, leather mix can be if there is if this severe type of pain. We put leather mix as anti-inflammatory. We reduce the inflammation site. Can be placed, or we can put zinc sodigenol, right? As a why zinc sodigenol? Not why not gatapercha, for example?
It's because that is a primary tooth and it's a resorbable, so that it
Very
resorbed.
good.
The tooth is resorbing as well.
Very good. Okay.
Yeah.
Can you do this treatment or not? As a general dentist.
Yes.
Look,
Yes.
guys, these are the questions you're gonna get for part one or part two. Where who's gonna do the treatment? You or a specialist? Or like an pedodontist?
We can do
The
it.
journey one. Yeah.
General candle. I'm very happy. What do you think about B Bravo? What sort of pain it is, and what is the treatment?
B can be asymptomatic and it needs to go.
Yes.
Very
Non
good.
unrestorable.
Very good. Not reversible. Need to be go. After extraction, are you going to provide space maintainer or not? And why?
Hmm.
Yes, it needs space maintainer.
It
Okay.
has, I think it has more than 6 months till the next one comes in. So
I
we
think
Okay.
it's the
might,
second premolar usually come around the age of 12, so it will be four
yeah,
years.
it has time, so we might need a space maintainer.
Okay. I believe in this case we need to take per apical X-ray to confirm this before we decide. We need to take a per apical X-ray. So where about the premolar? But 8 year old, I think it's like 50-50%. I'm somehow may or may not. Because now we're talking about tooth that's we call this is 3-5, right? 3-5 should be here. 3-4, right? So 3-4, I believe it can anyway can erupt anyway between 10 to 12-year old.
So if we consider 10-year-old, we may not need for it. But periapical X-ray will be the best to decide on this. See how close will be the premolar. In here right now, until this level, I cannot see any premolar. Maybe a little bit down, it can be there.
Yes.
Okay, good, good, good. Now, what else we need to know? A question as well, it can be related to this case is, doctor, there is any hole, any cavity, or any decay that's in need for attention. What do you think in this tooth, in this teeth?
Yes, there is some in enamel in uppers as well.
Please give me the tooth number. We said that's the left-hand side.
This left hand side, so it's between the D and E.
Between D and E, upper or lower?
Upper.
Upper. Mesial distal. We need to be very specific.
Yeah, it's
Let's say,
distal of D
look,
and mesial
the
of
best
E.
way to say it in exam and the way to think about it, you say the tooth number and then say the surface and then say the caries size. This is the right order we understand in Australia. So can we tell me the tooth number?
So tooth, this is left, so it will be 6'4" and 6'5".
Okay, this is 6 and this is 5. This is quadrant, sorry. This quadrant 6, this quadrant 7. Okay?
Yes.
And this is quadrant 5 and this quadrant 8. It should be 5, 6, 7, 8. Right? Okay. Yes, and the tooth number should be 6. You said 6, 5. I agree. Because it's 6, 4.
Yes.
Right? Measure distal side on 6, 5.
Yes, so it will be distal of 6'4" and mesial of 6'5".
Okay, one by one. Let's say 6, 5. Okay, 6, 5. So will be mesial.
Yes,
And then 6, 4 will be
distal.
distal. Okay. So now we need to talk about the size. Can we tell me, give me the name of the size? How we size it? How we call the size of it?
This will be small or
We don't have something called this small. We need to follow the same terms we use in Australia, or
Like
you say initial.
you can say initial. I'm happy with initial.
enamel or dentin caries, like that.
Yes, incipient, early,
Early caries, yeah.
right? All these words we can use. Is it a cavity or not cavity yet?
It doesn't seem to be.
Yes. So it means like not cavitated. So what's the treatment in this case?
So if it's only enamel, then remineralization.
Remineralization. Very good.
Yeah. So, and also in the lower one, Dr. Bito.
Good. Lower one.
Yeah. So this is 5, 4, 5, 4, 3.
Yeah.
The
Yes.
distal side.
3 distal like this side.
Yes. This is
Yeah,
also
it can be
caries.
caries. Yes, that can be caries. What about this? Which tooth is this?
This is a C. Sorry.
6'3", yeah.
Yeah.
This
6.
is
It
6,
seems to be
and there's 3,
broken.
right?
I don't
Yes.
know. It
That's
seems to be
4,
chipped.
5, and there's 6, and this quadrant 6 here until this, and this quadrant 2 until this the molar, right? So for deciduous, we call it 6, and for adult, we call it quadrant 2. So that's a quadrant 6 here for deciduous, and the quadrant 2 for permanent, right? So this is 63.
Yes.
Is that, what is this?
I don't know. It looks broken, but it could be that it was, decayed and then it just broke because of the decay.
I would say it's more into chipped rather than decay.
Yeah. So we can build on that if they want us to.
Yes. Dr. Sama, do you agree on this?
Yes, Dr. Bido, do we decide like with the decay it's more it's not very clear margins, and with decay they
Very
are
good, very smart. You see how decay looks like? Very regular.
Yeah.
Yeah.
But chipped part will be more into sharp like this. Most probably the tooth was weak at some stage and then the patient had a trauma on it and then got broken. Can you tell me which condition can make the tooth weak and then easy chipped like this?
Like hypoplasia or
Thank you very much.
hypomineralization.
Hypo. Which one is more weaker? Hypoplasia or hypocalcification? What
Hy-
Hypocalcification.
hypocalcification will be
Hypoplasia.
hypoplasia. Which one is weaker? Hypocalcification or hypoplasia? A little
I
bit
think
hard question, right?
hypocalcification will the hypocalcification in molars will lead to more breakdown. That's what I know.
So
Yes,
I
and
don't know.
hypoplasia as well.
hypoplasia is when the enamel quality is compromised.
No,
Yeah, it can keep.
hypoplasia, not
Sorry,
quality. It's quantity. It's a
quantity.
layering.
So it's
So
Yeah,
that
thin and can
yes,
be broken.
enamel is thin.
can keep
Now,
off easily.
very good. Now look at here. Do you think the enamel is thin here, or the enamel is good for a baby tooth?
It's good, I think.
I think it's good, right?
Yeah.
Yes. So that's mostly hypocalcification or hypoplasia. Okay.
Yeah.
Okay. There is one more point here for critical thinking. We all know how. We all should know how to manage this. The child is uncooperative. How we can manage this?
Mm,
Giving in, look at this. There's very critical point here. You must consider. Do you know which point we must consider this case? Very important to consider.
that
Like
they came
behavior
from
modification techniques.
far away.
Thank you. The far away patient is traveling 300 kilometers,
Hmm.
4 hours drive. Oh, right? 400, 4 hours drive, 300 kilometers away. What do you think in this case? Will you just easily tell the patient to go home and find a baby teeth specialist,
No,
like child specialist?
no.
No, you
Of
need to do
course,
something, right?
Yes.
yes.
What are you going to do then, guys?
Like behavior modification techniques,
Behavior management,
like
Just
different techniques, like tell, show, and do
tell,
technique, and
show,
distraction technique.
and do, and distraction technique. Yes. What else?
if that doesn't work,
Which one? If this doesn't work, yes.
then if we are certified, we can offer them the happy gas.
So are you going to be certified or not?
Yes, as a general dentist, we can get the certification.
Good. So are you going to offer laughing gas or not?
Yes, because we need to get the patient out of pain.
Very good. I'm very happy. I know the candidates failed these cases only because they don't mention about this part. And they've been against it. Sometimes it's your choice. Sometimes if you don't want to provide if you don't want to provide laughing gas, nitrous oxide, it's your option. But in the same time, give me a solution. I'm a dad, 300 kilometers away. I drove for 4 hours to come and see you because there is no any dentist around. Not because you are a beautiful dentist, only because there is no one around in the area. My daughter in pain. You must help me today. You must find something. Painkiller will not be helpful in this case, especially if it's severe type of pain. If this is true. So in this case, I believe the best way is laughing gas. And when I ask you, will be able to do it? Yes, I'll be able to do it. Why? Because I'm a dentist. I'm good dentist. I know what I'm doing. I'm safe dentist. I did this case before, and I'm here to help you. That's why I'm happy to do the treatment today for you, and I will be able to do it. I will be able to provide laughing gas. Are you confident about it? Very confident about it.
Yes.
Clear now, guys?
Yeah.
Yes.
I just have one question, Dr.
Yes, please
Iman.
tell me.
So even if we do administer the gas, then we won't do everything today, right? Because we can't. It's too extensive. So we will just take her out of pain.
Yes, you focus today on the pain, and then the rest can be done even by specialists. It's up to you then.
Okay, even if it involves numbing, then like working on both sides.
Yes, try to do your best today. Manage the tooth which is in pain. That's another question because that's what I will ask you. Which tooth will you start today? And
Yes.
then after this, it's up to you. If the patient is happy and want to come back to you 400 kilometers away, will be good. Otherwise, if you can help him, that will be great approach. This is the best approach. If you help him to find a dentist next to him, or maybe a specialist, if you want to get all the things to be done. But if you want my opinion, I'm good dentist. You drove this time 400 kilometers. Drive again next time. We can do all the teeth next time. Then today we're gonna focus on maybe one or two teeth max. If I'm able to do more than this, I will do it. If anything left, anyway, I need you to come for follow up. So next time you come, and then do the rest of the teeth.
Okay. Yeah.
Doctor,
Easy.
I have a question regarding laughing gas as well. So there is a limit how long we can provide the gas as well.
Look, we normally love it, guys. We don't last. I would say max of like 45 minutes would be fine.
Okay.
If you can do something, just make it 45 minutes. So 45 minutes is enough to do multiple teeth.
Okay.
Okay, yeah,
Okay.
max. And then anyway, you increase in oxygen, decrease in the medicine, and then increase in oxygen, decrease in medicine. So just make it fine. Not, it's not an issue as long as the vital signs of the child is okay.
Okay, doc.
Okay, no problem at all. Okay, guys, who wants to start this case? Now I think the case is not hard anymore, right?
Yeah.
Okay, guys, tell me please, who guys want to start this case? I'm happy, guys, with any one of you. Tell me.
I'm okay if Dr. Summer wants to go ahead.
Okay, I will go ahead, but I haven't prepared Dr. Fido.
That's okay. We can make Dr. Amna now, and then you next time. Look, there is no pressure at all. If you feel good, look, I know you are always good, Dr. Sama. If you feel like you can do it right now, we can do it now. If you want Dr. Amna now, and the next time, you can do the next time, Dr. You can do next time then. No pressure at all.
I think I will let Dr. Amna to go this time.
Okay, no problem at all. But you must do. Look, I let you only go this time, but next time I will not let you go. Okay.
Okay, doctor.
Okay. Be aware about this.
No worries. Thank you, doctor.
No problem, Dr. Sam. No problem at all. Okay, but it was thank you very much. All you answered all the question correct. It means like you're really doing great.
Oh, thank you, doctor. Thank you for giving me the chance.
No problem, Dr. Sam. Okay, guys, let's now get the timer. Give me just 1 second, please. I got a timer for you, Dr. Amna.
Yep.
No problem. I'm just now the timer will start. Do you want 1 minute or 2 minutes, 3 minutes?
2 should be fine.
Two should be fine. Okay. Okay, guys, in the exam, they will give you 3 minutes reading time. And this reading time is very important, very, very important, because you need to write down all your ideas. And please, guys, write down because you will forget. Very important to learn how to write down. So start to practice on this and write down in the abbreviations, not too many things. The bold part is the most important thing. 2 minutes to you now. Set up to you now, Dr. Anna.
Yep.
All the best to you then. Please, the bold part. Write down your notes,
Yeah.
right? Tell me the findings. By the way, which case is this? Is which cluster?
I think it's cluster 2 or 3. 3 if
Three. Class three,
yeah,
because treatment plan.
because yes, they did
Treatment plan.
actual diagnosis. Yeah.
Yes, treatment plan.
Yeah.
So treatment, it is a clinical treatment and the evaluation cluster. Okay, 3.
Yes.
Please, guys, everyone is attending the session right now. Every single word we have discussed, me and Dr. Sama and Dr. Amna, they are very important. These champions have been in part 1 before and they know all this stuff. And everyone for part 2, this thing is very important to you as well. So please, guys, write down everything in details and then keep in your notes because the mock exam as well will have questions from what we discussed right now. Tomorrow you will find questions whatever we discuss right now, but in different styles to make you think more the way that CDC exam is. 10 seconds left, doctor.
Yeah.
All the best to you then.
Thank you.
Start, please.
Thank you, Mr. Malcolm, for being patient while I was having a look inside Sophie's mouth. And although she was a bit hesitant, but I managed to take a few x-rays and I'm going to discuss that with you. Now, I understand you've driven quite a long distance to bring Sophie in here with me today.
Totally right, doctor. You're totally right. So, doctor, I'm just wondering because I forgot your name. What's your name, doctor? How can I address you, doctor?
Okay, so I'm Dr. Amna, and I will be Sophie's dentist for today.
Thank you very much, doctor. I'm Dr. Amna Lok. Sophie is a beautiful girl. She
Yes.
is my only daughter, and I love her very much. Anyway, I got divorced from her mom, and I'm the one looking after her right now at this stage. I'm always busy at my work, and only a few weeks later, when I looked at her teeth, I found there's lots of discoloration and dark brown holes in her mouth and the teeth and all around. And then I was really worried. And then nothing has happened. And then after some time, she told me, Dad, my teeth really hurt a lot. I cannot eat anything. I cannot chew anything. I cannot drink cold water at all. When I drink my juices, especially in school, I really feel really sensitivity in my teeth. And she couldn't sleep last night, doctor. I'm here today because I really need you to fix her teeth. She's in pain. Please, doctor.
Yes, yes, I can imagine. Now, I've taken some x-rays and let's discuss those first so we can understand better what's going on. Now, if
Okay,
you look
doctor.
at these, yes, if you look at these x-rays here, now this is the right side and this
Okay.
is the, yeah.
Do you
So
mean this one, the right side?
the other one.
The
Sorry.
other one, the
Yeah,
right side.
sorry, but yeah, this is the right side. This is
Okay.
the right side and this is the left side. Now, Sophie, right now, she's in her mixed dentition stage. Now, one by one, I will explain. These end ones are the adult teeth and the rest are baby teeth.
Okay.
Okay. Now, these shadows over here are the spots that you see in Sophie's teeth, the ones that you mentioned.
Okay.
Yes. And this is what we call as decay.
Like cavities, like holes, right?
Yes, yes, she's having
Okay.
holes in her teeth. Now,
Okay.
what happens is that we have three layers to the tooth. The outer one, as you can see, the whiter part is the enamel. The
Okay.
next softer is the dentine, and inside this shadow, as you can see, is the nerve. The closer the decay gets to the nerve, the more sensitive it starts becoming. And when it reaches very close or to the nerve, then you start getting pain, which is what Sophie is having right now.
Ah, okay, doctor. Doctor, I'm not quite sure because Sophia not with me today. I'll with me right now. She's in the car anyway. I'm not quite sure actually which tooth could be hurting her the most. So, doctor, which tooth right now do you think is hurting her the most?
Has she pointed to any side, like, touch any side? Is this
Yeah,
spot here?
sometimes she's saying the right hand side, sometimes the left. I'm not quite sure, doctor. Which tooth really waking her up from the pain?
Okay, so if we look at the left x-rays and we look at the lower baby teeth, these are the ones which are decayed the most. So I believe this is where
You
the
mean
pain,
this one?
and the one next to it.
Okay.
Yes, the pain might be coming from here, the one which is keeping her up at night. And when it
What
comes
does
to,
it mean, doctor? Is this infection?
it could be because I don't have the x-rays which make me look at the tip of the root.
Look, I know, like you had a look at Sophia's teeth, and then she cried a lot, and then she went to the car right now.
Yes.
So, doctor, when you looked at her teeth, did you notice any swelling down there, or notice any infection there?
No, I did not notice any swelling or discharge. But we confirm by taking a X-ray, which
Doctor, when you take an X-ray, what will you see in X-ray?
we can see some shadows at the tip of the root.
Is it necessary every time if there is infection, you see a shadow on the tip of the roots?
Usually we do, but if she's having symptoms like there is a swelling, there is an obvious swelling, and then there is discharge, then we can tell about the infection straight away.
Okay, doctor, that's okay. So, doctor, what are you going to do today for this tooth?
Yes. So for these teeth where the pain is coming from, the priority is to get Sophie out of pain today. So the first one, on the left side, if you look at the lower side, the baby tooth, which is um, 6, 5, the one at the furthest back. Now over here, the nerve needs to go.
The nerve needs to go, not the
Yes.
tooth itself.
No, not the tooth itself, because there is structure remaining to it.
Okay.
Yes. So
So
for
you
this,
mean this? You mean the second, the last tooth from the
yes,
back. This one.
second last. The last is the permanent one. The
Okay.
one
So the
next to
second.
it,
Okay.
yeah,
Okay.
the one next to it is a baby tooth. So the
Okay.
last baby tooth I meant.
Sorry, doctor. I don't know which one's baby or not, but you said from the back.
Yeah.
It's it's a second last, right?
Yes. The second last, I need
Okay.
to do a nerve treatment, which we call a
Oh,
pulpectomy.
doctor. I thought this nerve treatment. Do you mean root canal treatment? I thought it's only for an adult teeth, not for the baby teeth.
No, there is a nerve treatment for the baby, which is slightly different than the adult one. But yeah, there is a baby root canal procedure as well.
Ah, okay.
Yes.
How long, doctor, for how many times I need to come and see you? How often? Because I'm very busy and then I drove for 300 kilometers to come and see you, doctor.
Yes, I understand. Now, for the pain, I can do everything today, but there are also other fillings that need to be done, because there are holes in Sophie's other teeth as well, which give her that pain in which the food is getting stuck. And when you brush
No,
the
doctor,
teeth,
let's doctor focus on this one right now.
okay, yeah,
How
I
long
can
it
do
takes
this today. Yeah, I
today?
can do this
Okay,
today.
very
Yeah.
good.
And
Okay,
the one next to it, it's almost gone, as you can see. And
that's
it
okay,
needs,
doctor. I'm not worried about the one next to it right now.
okay,
Let's go step by step. Otherwise, I'll be confused.
okay, okay.
Okay,
Yeah.
daughter. Now you have seen that Sophia jumped on from the chair and then she ran away and then I took her to the car. Do you think we will be able to manage her today?
Let's try. Okay.
Ah, let's try. Sorry,
Let's
she's
try to counsel with start. Let's start with what we call as behavioral management. Okay. This is when we try to distract the child by putting on some TV and doing some music, and then talking them through the
she doesn't
treatment.
like music, doctor.
Okay. But if that doesn't work, then the next option that I have is the laughing gas.
Oh, what is laughing gas, doctor?
It is basically a gas that we admit. It is also called the happy gas. So it is administered in which there is the Sophie can kind of
Like on a mask?
yes, on a mask, and then she'll
Okay.
inhale that gas, and then she can go through the treatment very peacefully.
Doctor, will both her sleep then?
Yes.
Ah, we'll put her to sleep. Okay.
Yes.
Okay.
Not like she's not gonna go under, so like kind of half asleep.
Half sleep.
Yeah.
Okay.
So she'll be able to
Will she be
tolerate,
cautious or not cautious, doctor?
she will be conscious.
Will be conscious, right?
Yes, she's conscious, but she will not fully understand what's going on.
If she sleeps while you're doing the procedure, what will you do, doctor?
So,
Will you stop this loving gas? Is it really something dangerous?
yes,
What will you do?
so when if that happens, what we do is that it is a combination of two gases. So we switch off one and then we increase the concentration of other one so that she can wake up.
This is the first things will you do, right?
Yes. We will
Okay.
decrease the and then we will stop administering the gas so that she can wake up.
Okay,
We
that is
can
good.
completely manage it. It's completely, and we do it on a very regular basis. So don't worry about it.
Okay, thank you, doctor, for this. Doctor, the next door tooth, what were you doing it?
This is like a hopeless tooth, so it needs to go. Extraction.
Okay, doctor will be putting or replacing this tooth with any other tooth, or just
So
we
it's a
shouldn't worry
baby.
about it. Yeah.
It's a baby tooth. Right now, I'm going to take it out, and then when Sophie is ready, we can take another X-ray and see if we need what we call a space maintainer, so that we
Will
have.
you do it, or should the specialist do it?
Yeah, I can do the space maintainer, no problem.
Okay, doctor.
Yeah.
And the same time now, doctor, I'm thinking. She said that she has one tooth that when she bites on it, or she had some feelings in some food inside. She got really very severe pain. Do you know which tooth it is?
Yeah, so if you come to the right side and you look at the lower teeth, now there is one at the bottom, and I also see one at the top, the third last.
Okay.
Yes. So it could be those. So I'm gonna ask Sophie, like, where is she feeling the pain?
She's a baby, doctor. She will not be able to tell.
Yes, but both
Thank you.
of these,
Thank you, doctor. Time's up.
yeah,
It's all good then. What do you think?
it was a marathon.
Oh, what?
I don't
Yeah.
know. I completely forgot, not forgot, I got confused in the numbering because I'm very much used to using C, D, E for baby teeth.
Yes.
So, yeah.
That's okay. In Australia, we sometimes use them, but not often. Often we use um, this numbering system, like you divide every quadrant as 1, 2, 3, 4, 5, 6, 7, 8, and this stuff. Okay.
And I
I think
have
that's a
one more
federal. That's a federal.
question,
Huh?
Dr. Pilo. I have just one question.
We're gonna go lots of questions here because there are lots of concepts we need to fix here. Okay.
This dot on the X-ray, you see?
Yeah, that's a lot. Yeah.
So, can you, with the help of some people, tell right to left with the help of this dot?
Depends on what did you do as a dentist. Dentist sometimes put it right, sometimes put it left, sometimes
Yeah.
put it top, sometimes yeah, it's like it
Oh,
depends on the dentist where about they put it. Sometimes they can put it right, I mean correct, and sometimes incorrect.
okay. So it's not reliable.
No, it's not reliable as long as you are not the dentist made it. If you are the dentist made it, you can put it on for bite wing for right hand side should be mesial on top, and for the left hand side should be mesial. Sorry, distal on the top, and then the left hand side should be distal and bottom. Right?
Okay.
But
Yeah.
again, depends who you are.
Oh,
Okay, because yes, you need to know. Because some dentists can do the way around.
okay.
Okay, now you did look communication skills perfect. I think it was very clear. You didn't hardly we finished the case just the right time. However, you didn't ask me a single question, right? We hardly finished the case on the right time, and I ask you my concern. Now, everything you have mentioned was really great. I really liked them, except the confusion I have seen from you when you trying to choose the right answers. When you try to give a proper name for the teeth. Am I right about this?
Yes, the numbering I messed up.
The number, and you get confused about it.
Yeah.
Number two, the name. Please, still, I need to know your name, even if it's
Cluster three.
cluster three, cluster two. You did examination, you did diagnosis. You're now going to treat. I still need to say your name. I need to respect you. I need to respect you to call you by your name, Doctor Amna.
Okay.
I don't just say doctor and that's it. Okay?
Mm-hmm.
Okay, because we built up rapport once. Once we call the patient with name by names or the dentist by names. Now, I don't like this word. I hate it. Sophia, not an. She's a human. She's a girl. You cannot do experiments on human. I don't like that this experimental word. Let's try. Do you get my point?
Yes, I do.
It's a communication thing. So I believe if I have my baby and then you tell me let's try, what you gonna try, doctor? If you're not confident about what you're doing, why you doing it then?
No, let's
And
try and distract the child. That's what I meant.
still, I don't like the word let's try.
Okay.
You can choose better word, right? You can say For example, let's do it.
Okay.
Okay?
Yeah.
Yes, let's better than say let's try. Are you happy to do it? Can we start right now? Okay, and then the patient say yes, you can, doctor, start. And if things didn't work, but in exam you should make it work, you can say, I did my best. Just in case. If they said, doctor, what if you cannot do it? I will do my best to do it. What if, in this case, I may give prescribe painkillers and then I refer her to specialists, but this is the least you can say this. This is going to be the least option for today. Today, I'm confident that we can manage here today. I'm very good with kids. I know how to manage kids. They will love you very much when you start saying this.
Okay.
Okay?
Yeah.
Now, sleep. No. Laughing gas doesn't put the kids to sleep.
No, it doesn't. It's a GA puts you to sleep.
Exactly. If the child sleeps, what do you need to do?
So we
I will
need.
keep this. I will no. I will keep this question for the mock exam tomorrow.
Okay.
Don't answer, okay?
Okay.
Okay. And then
Shadow.
shadow.
Yeah.
Not in every time an infection should be existent.
Okay.
Because sometimes in acute cases, you may end up or may not end up with widening of periodontal membrane. In just acute cases, initial acute cases, like you have a periapical infection, if it's acute periapical infection just only started today or day before, hardly you can see a little bit of widening of periodontal membrane but not shadow yet. And sometimes too hard even to see on X-ray. But if it is chronic type of infection, yes, you can see shadows around it. Did you get it?
So what? So the question was like, you examined her, and did you see any infection? So what's the
No.
answer to that?
The answer is I haven't seen any swelling, as you said, no swelling discharge. Only the X-ray showing that is the hole is too deep into the nerve, and that could be an inflammation in the nerve. I want to hear the word inflammation because most probably that's irreversible pulpitis. What she's having.
Okay,
Okay.
and but Dr. Bido, the one next to it, there is a shadow infiltration. So
That could be chronic infection,
okay.
and that's why she has a little bit of pain on biting. But when you have an infection, it will not be just pain. You know what will be?
Yes, abscess.
Yes, abscess. How the abscess, like if you have acute abscess, how the pain will be?
So acute
Severe type of
abscess
pain,
is
right?
a lot of pain.
Yes. What happens when the patient touches a tooth? Will be very tender. We
Yes,
call it
very sore.
very tender. No
Yes.
pain. The tooth is tender. So when you have acute abscess, the tooth will be tender. But you don't have this pain here, this information here. Did you get my point?
Yes. Yes. Okay.
So based on the information provided in this scenario, seems like it's not an infection, it's more into inflammation, not an infection.
Okay.
Here right now,
Yeah.
How was the case? How many points we discussed today? Lots of points, right?
Yes.
Okay. I'm very happy with this. Let me check the champions if they have questions so we can answer together these questions together. Okay.
Mm-hmm.
Give me 1 second, please. Guys, please, guys, if you have questions, guys, let me know. I'm not quite sure if you answered the questions or not before because I'm trying right now to check your answers, but I think it's a late answers. And please, guys, ensure next time. Am I audible, Dr. Anna?
Yes.
And please, guys, next time, ensure that you actually, guys, provide answers as well so you can learn. Because I need you to think as well. Even if you're going to answer wrong, that's okay for now. We all do wrong answers, guys. We all, like I do wrong answers. I'm human too. Dr. Amna, you, everyone, it can. But we need to improve this to get always right answers.
Dr. Bidu, I have a question.
Yes, please, say me, Doctor.
Regarding pulpectomy or root canal treatment, do we need to see how much root resorption has occurred? Like, what is the cutoff point for like we do and we don't?
Sorry, can you restate this question again? Sorry, because I've been jumping from Facebook to the stuff again. Sorry.
No.
Say again.
So I want to say how much root resorption should be there that will contraindicate the pulpectomy or root canal treatment?
This is a very good question for a baby, right?
Yes.
Just tiny, like if it's more than 1/3 of the roots, or just going to be 1/3, don't do any type of this treatment. If it's just a little bit of root resorption, the apex, like maybe only 1 millimeter max, you still can do it. More than this, I don't think you can do it.
Okay, doctor. Thank you.
Okay, no problem. So good then. Okay, guys, any more question, guys, everyone? Let me check now the group and then we can discuss the questions together. Am I, guys, still online? I'm live? I don't think I'm alive there. What is happening? Why it's very weird my... Why I'm not live? Oh, no. Now I can see. I'm okay. Now I can see. Okay. Okay, guys, let's now read your... Okay, guys, let's now go through your questions one by one. And I'm sure, guys, you're gonna ask very nice questions now. Okay. Now, please, guys, we can provide the questions. I don't know where I am. Just answer this one. Pause. Then what we need to do is refresh again to be able to see your questions. Good, good, good. That's the one. It's okay. Okay. Facebook. I will read them from here, from my phone. Okay. Very good. Now I can see. Let me share again. And this one should be double like this one. Okay, guys. Yeah, now it's good. Okay, a question now. Dr. Anna, are you ready for the questions now?
Yes.
Okay, the question is, and Dr. Anna, Dr. Sama, a question. Dr. Yamuna asked, I'm confused how to use KFSP. I think now it's good now. I'm confused how to use KFSP in the side. Let me just get this one a little bit smaller. Okay, I will show you now, doctor, okay? Give me a second, please. I will show you now how it is. I will share the screen right now. Let's look at this. Actually, that's just the one I'm gonna put here. Yes, this one, this X-ray. Guys, can you see, guys, this X-ray, please?
Yes.
Okay. Now, Dr. Yamunna, please look at this. There's a curve speed right now. Start from here to there. Going up. It starts from here and going up. Now, which one the right-hand side, which one the left-hand side? That's the right-hand side.
Yes.
And this is the left-hand side. So from the center incisor to the last molar should go up like this. Okay? If you go and check my X-ray here, okay? So now the highest part of the curve, it should be the distal. The highest part of the curve should be distal. The lowest part of the lowest point of the curve should be mesial. Let's now apply this rule on the two X-rays I had. Now let me share this now. So remember, the highest point, it should be on the distal, and the lowest point should be on the mesial. Now, if you apply this rule right now here, guys, can you see, guys, my screen, right? The two X-rays right now. Am I right?
Yes.
Okay. Let's apply this. I will do the curve of P and tell me where about the distal and where about the mesial of each X-ray. Now, that's a curve of P.
Yeah.
And this is a curve of P. This is a distal.
Yes.
And this is distal. And this mesial. And this mesial. Think about it. If you're going to put this together in one patient mouth, you need to put mesial next to mesial, right? So you need to put this tooth next to this tooth. Try now. I will do it now in the right way. Okay, guys, give me 1 second, please. I will do it now in the right way. You will go, wow, you'll go surprised now. Okay. What do you think now?
So, sorry, Dr. Bido, can they flip the X-rays in exam?
Huh? No. I'm just ready to explain to you.
No, I'm saying in exam.
Yes?
Can they flip the X-rays, or
You can flip it?
can they, the examiner?
Anything can happen.
Okay.
Anything can happen, definitely. But you need
Okay.
just as easy concept. Now you can see. Now
Yes.
that's mesial and that's distal. That's mesial, that's distal. Did you get it? Mesial, distal. Mesial, distal. So now that's the left-hand side, that's the right-hand side. Clear right now?
Yes.
Okay, good. Let's go with more questions. Sometimes they're only going to give you one X-ray, no necessity to be two. Did you get my point, Dr. Amna? So
Yes.
you must be able to tell even from one X-ray.
They're right from left. Yeah.
Exactly, even one X-ray. For example, they can only give you this one. Imagine. And now they tell you, is that right or left? This one only. Do you get my point?
Yes.
Sometimes they crop it. Not even giving you this. Sometimes they may give you even this. Look at this, they crop it. They only give you this, imagine. And they're going to stack badly. Look. They only give you from this level. Only give you this part. And they tell you which teeth are this. Now think about it. Only this, imagine, I swear. They crop OPG, only give you this from OPG.
Yes.
And tell you which side it is. Now we need to know, not Caries P. Yeah, Caries P still existing. Because if you look at it, that's Caries P here.
Yes.
But also from the size of the tooth and the inclination of the tooth. This is inclined mesially. Mesial.
Yeah.
So it means like mesially toward the mesial side. That's the mesial side. That's the left-hand side. Did you get it?
Yes.
That is critical thinking guide. That's why we do Tuesday session. Because exam is all about this, not just about reading. Okay, what else we need to do? Another question. Why 16 minutes? I don't know which one is this one. Yeah, it should be from here. Yeah. Okay, guys. Any more question, guys? I can see question. Why cannot 8.5 be the cause of pain? It can be, Dr. Deepika, definitely. It can be. Okay, guys, I think, guys, we have done great for today. All the best to everyone for the mock tomorrow. Mock will be 8 p.m. Sydney time. Will be somehow, the mock is going to show your level. How far are you from ADC? Thank you very much, guys. I was very happy having all of you guys tonight. Thank you very much, guys. See you then tomorrow in the mock, and after tomorrow, we'll have a session as well. Thank you very much, guys. Yes, Dr. Anand, tell me.
Sorry, Doctor. I missed that one where you said that space maintenance, it will be the we will be given a space maintenance, or we will refer to the
No, space
orthodox.
maintenance we can do it in our own.
Okay.
You see, we can do space maintenance.
Oh, thank you, Doctor.
No problem at all. Thank you very much.
Okay.
No problem. Thank you. Thank you very much, guys.
Thank you, Dr. Bido.
Thank you very much, guys. You did great. Thank you very much for this. You really did great, guys.
Thank you.
Thank you very much. Okay, let me check, guys. If anyone still has any question, I can do it for you. Thank you very much, Dr. Mustafa. Thank you, Dr. Dara, very much. Thank you, Dr. Lev. Thank you very much. Thank you, Dr. Sayeda. Thank you, Dr. Winnie. Thank you, Dr. Jasmine, Dr. Neshma. What is the concentration of oxygen oxide? 30-70. We like to be in 30-70. Sometimes can be 50-50. More toward oxygen than nitrous oxide. Because more than 70, which is a max for nitrous oxide, you're now not going to do sedation or minimum sedation. That will be non-minimal sedation. Thank you, Dr. Mustafa. Thank you, Dr. Maheen, very much. Good night to you too. Thank you very much. Dr. Dr. Penn. Very nice name, Dr. Penn E. Fu. Hopefully I pronounced it right way. Thank you, guys. Tomorrow is the mock. Thank you very much, you guys. Have a great night, every one of you guys. Please, guys, in the mock, read properly, answer the question nicely. Don't be stressed. Don't be under pressure or stress at all. Thank you very much, you guys. Have a great night, guys, every one of you. Thank you. Thank you, Dr. Natalie, very much. Thank you, guys. Have a great night, guys. Bye-bye. Bye-bye.